Hi everyone, my name is Jose, and this is my professional portfolio. First is my biographical information. My name is Jose Atangan, and I live in Burnett Drive in Escondido, California. And these are my contact information. My email address is jatangan484 at usuniversity.edu. My position statement, so I am well experienced and registered nurse. I work closely with our geriatric population. I am well versed in both nursing administration duties and also with my clinical bedside care. And all the nursing positions that I've held since I started my nursing career, I have been very dedicated to all of them. I have proven my skills and strength in patient care, family advocacy, as an educator, and staff empowerment. And being a nurse consultant, I am responsible in guiding, leading, and making sure there's excellence in practice while adding value to the organization's clinical and operational success. My goal as a new nurse practitioner is to provide quality and competent care that are focused to the needs and beliefs of all my patients. I will ensure that every concern of my patient and their families are being heard and addressed. I will have to be in a collaborative agreement where all goals are set by both the patient and myself. And my purpose as an FNP is to direct care and enhance the well-being of all my patients. Because I know that the patients are the one who are in control of their health, and I just want to make sure that I am guiding them in maintaining a healthy lifestyle. I will always practice with my patients' safety in mind and will help them to understand that their current health condition through education. And by giving my patients multiple health options that can best suit their needs, that can help them maintain and promote a healthy lifestyle. For my curriculum vitae, so my objective is to obtain a position in the medical field that can provide quality nursing care and would best fit my qualification that can enhance and improve my character. So I currently work as a clinical MDS resource or consultant for Ensign Services. And I've started my nursing career as a CNA in 2009. And then I became a charge nurse, medication nurse, treatment nurse, then eventually became an assistant director of nursing and the unit nurse manager. Then I worked as a RN supervisor in a skilled nursing facility. Then became a registered nurse MDS coordinator. Then to my current position as a MDS clinical consultant. My educational background, I'm currently doing my FNP, MSN FNP at United States University, and I completed my Bachelor's of Science in Nursing in Centro Escolar University in Manila. My credentials, I am a registered nurse here in California, and I'm also a registered nurse back home in the Philippines and also an IV therapy nurse. For my certification, I am a certified resident assessment coordinator, and I also have my basic life support for healthcare provider through American Heart Association. And for my computer skills, I am very proficient with Microsoft Microsoft computer system. And for my electronic medical record, I've used Point-Click Care, eClinicalWorks, and Practice Fusion. And here are my two references. I currently have a nursing liability coverage through NSO. And here are my diplomas. So the first one is my associate's degree in health sciences education. And then the second one is my Bachelor of Science in Nursing. And both obtained in Centro Escolar University in Manila, Philippines. And here's the summary of my FNP education in United States University. So these are all the courses that I took throughout my 2-year MSN FNP program. And I'm currently on my clinical residency and practice management and my evidence-based capstone project that is about to end for another week. And for my clinical cases, so here are the different program, and these are the cases that I have within those programs. So for my acute care illness, I have 16 cases. My chronic illness, I have 17 cases. For my clinical residency, I have 16 cases. Common illness, I have 16 cases, and for my health assessment, I have 4. And then the second one is the different practice that I went to. So for my, I did pediatrics, geriatrics, family practice, and in women's health. And these are the different age group that I've worked with. So for my pedia, I've worked with newborn, peds, and teens. And for my family practice, I've worked with adults. And also for my women's health, most of them are under the category of the adults. And then for my geriatric rotation, I've worked with geriatrics and frail elderly. And so like what I said, these are the different practices that I did my clinical rotation. I did adult, my OB, pediatrics, geriatrics, and family practice. And these are the clinical sites that I did my rotation. I did it at First Choice Providers, in Operation Samahan Health Center, and in San Isidro Health. My certifications, I have an active RN license here in California, and I also have my basic life support through the American Heart Association, and my resident assessment certification through the American Association of Nurse Assessment Coordinator. My professional organizations, I am a member of the ANAC, where I am certified as a resident assessment coordinator. And I'm also planning to be a member of the American Association of Nurse Practitioners. And this is just one of the sample of certification of appreciations that I've got through my nursing career. And for my reference articles, so these are the 5 articles that I obtained. And reading through these articles, reading through these studies, so the conclusions of all these studies and articles have shown that the addition of a nurse practitioner to the primary care services does improve availability of care, and it results in positive effects on the problems that the healthcare system is facing. And I also believe that the addition of a nurse practitioner does add a lot of value, not only in the medical field, but also in research and development in improving healthcare system. For my final reflection, as my student days is coming to an end, it is such a big relief that I overcome one of the things that I've stressed on a weekly basis for 2 years. This this NP program helped me to think as a provider and the different levels of prevention using an evidence-based approach. I believe that those learnings and experiences can make me a better nurse practitioner that uses critical thinking, sound judgment, and clinical eyes in assessing and managing different types of condition. As I transition into my new role as an advanced practice nurse, I will continue to hone my skills in collaborating interventions and plan to prevent, treat, and promote wellness based on research, guidelines, and standard procedures to all my patients. Through this program, I was able to practice multiple advanced professional roles such as a provider, an educator, and a collaborator through my clinical rotations. As a new nurse practitioner, I will be part and an active member of a nurse practitioner organization that can help me understand my new role in the healthcare industry. I will continue to attend seminars and educate myself with all the new updates and evidence-based interventions that can guide me in my practice. And I will collaborate with my NP colleagues and other medical professions for any issues and or questions that I might encounter in the future. So that is my professional portfolio. Thank you for listening.